Hey, I'm Dr. Gardner, and this is my 3-minute short on mast cell tumors in dogs. So, mast cell tumors are the most commonly diagnosed skin cancer in dogs. Mast cells are a type of white blood cell, and they contain granules, and within those granules, there are many different things, but histamine is one of them. These mast cells can have something called degranulation, where those granules release their contents, so histamine is in them, and that can cause a whole slew of possible reactions similar to allergies, runny nose, swelling, redness, and in rare cases, it can cause anaphylaxis, which is a life-threatening allergic reaction. Typically, mast cells, the first thing and only thing you notice is that they have a new lump or bump. It can be something that's been there for a longer period of time and has changed. And mast cell tumors are called the great pretender because they can look like just about anything. There are some breed predispositions, so these dogs are more likely to get mast cell tumors, so there is a genetic component. And when we usually see them, the first thing we'll do is an FNA, which is a fine needle aspirate. So we'll take a sample of the cells from the tumor with a small needle. We will look at that under a microscope and also send it off to the lab. Usually I will give a dose of Benadryl prior to doing an FNA or a biopsy, so that if there is any type of degranulation, you're minimizing the risk of an allergic reaction because of all of that histamine release. So your vet might do that as well. Then after you get the results back, there are 2 staging systems. So one is a grade 1, 2, or 3, with 3 carrying the worst prognosis. And then there's also a staging system where it is considered high grade or low grade, with high grade carrying a worse prognosis. And typically most labs will report both, and that will give you more information about prognosis. If your dog has a low-grade mast cell tumor, typically surgery is where you want to go, and so we'll resect it, and usually that's it. That carries a pretty good prognosis with years of life afterwards. If, however, it is a high-grade mast cell tumor, then typically it will be surgery plus chemotherapy and/or radiation. There are a lot of new therapies out there, and I will put some links and some information in the description below because I don't have enough time in this video to share about all of those. I also think that while natural therapies do not replace surgery or chemotherapy, there are some great things that can support your dog during this time, including turkey tail mushroom, omega-3 fatty acids. Acupuncture is a great adjunct to support the immune system, along with all of these other great items. So there are definitely things to consider. If your dog has had mast cell tumor, I would love to hear what your experience was. If you have any questions or comments, I would also love to hear from you. I hope you will like and subscribe, and I will see you next time.